When we're looking at ankle stiffness, we've got two types of movement that we can restore. We've got our physiological movement, which are our normal plantar flexion, dorsiflexion at the ankle joint, and that's something that we can teach the patient to do with an exercise. But then we've got our accessory movements or joint play movements, and that is a movement that the joint is capable of performing, but over which the subject has no control. So what I want to be doing is moving the ankle joint forwards and back. So we're using an AP direction. So I'm using a block, and this can be, this is just a yoga block, but obviously we can use a foam block, or we can just use a series of folded towels. This comes under the tibia, away from the Achilles, so I've got a little gap here. And then I'm coming around, blocking the top with my web space, and then I'm cupping my hand beneath the calcaneum, and all I'm doing is pressing down with one hand and drawing the other hand forwards. So I'm mobilising the ankle joint and I'm mobilising the sub-taloid joint at the same time. If I transfer that forwards now to the block under the heel, and we would normally pad that with a towel, I can reverse the movement. So I'm coming around now, and I'm now performing the movements that the tibia is going down and the joint, the foot is coming forwards, which gives me a PA mobilisation at the joint itself. And then again, using the block, if I want to mobilise into the sub-taloid joint, I can use my hands cupping around the calcaneum, come down into this position, and then I can swing from side to side. So that action is more onto the sub-taloid joint. And once I've taken a hold of the calcaneum, I can draw backwards. So if I draw the heels of my hands together, then I can simply lean backwards, and that then imparts a little bit of traction or longitudinal mobilisation to the joint itself. So fairly non-specific in that we're moving ankle and we're moving sub-taloid joint and also the mid-tarsal joint, but to alleviate some stiffness prior to the use of exercise therapy, or simply as a form of pain relief in itself.